Counseling 6303, Houston Baptist University, Chapter 12, presented by Dr. John Spody. Sexuality during childhood and adolescence. Sexual behavior during infancy and childhood. Infant sexuality, capacity for sexual response present at birth. Sexual behavior is a normal part of development. Infants engage in self-pleasuring activity, unable to differentiate sexual from sensual pleasure. Childhood sexuality. There is limited research on childhood sexuality. Common behaviors at varying ages include, from ages 2 to 3, masturbation may begin. 4 to 7, sex play begins. 5 to 7 years, marriage scripts enactment begins. 8 to 9 years, girls and boys play separately. 10 to 11 years, interested in bodily changes. A couple of questions for us to consider as we look at this chapter are: what common patterns characterize emerging sexuality during childhood? And what is the nature and mean of sex play with friends during childhood? Physical changes in adolescence. Puberty refers to reproductive organs maturing. The onset of puberty between the ages of 8 to 14 years old, 2 years earlier in girls. They are triggered by the release of gonadotropins. Males' testes increase testosterone production, and female ovaries produce elevated estrogen levels. Figure 12.1 shows hormonal changes during puberty triggered by the influence of the hypothalamus over the pituitary gland, stimulate rapid growth and the development of secondary sex characteristics. Physical changes in adolescence. Primary sex characteristics of girls: thicker vaginal walls and larger uterus, vaginal secretions, and menarche ages 12 to 13. Primary sex characteristics of boys include large prostate and seminal vesicle, and first ejaculation around age 13. Physical changes can be sources of pride or concern. Sexual behavior during adolescence. The sexual double standard. Different standards of sexual permissiveness for women and men. In general, society has more restrictive standards applied to women. Girls' sexuality focuses on relationships. Dilemma to appear sexy but not easy. Boys' sexuality focuses on conquest. Peers reinforce aggressive and independent sexual behaviors. Masturbation. Increase in frequency during adolescence, more common than partnered sexual activity. Can serve as an important avenue for sexual expression, an always available outlet, and a way to learn about one's body and increase self-knowledge. Non-coital sexual expression. Kissing, holding hands, touching, manual and oral stimulation of genitals. Oral genital stimulation has increased among teenagers. Many consider oral sex more acceptable, a way to experience sexual intimacy while maintaining virginity. Most are unaware of the potential risks associated with oral sex. Ongoing sexual relationships. More common at this age than in the past. Contemporary adolescents are more likely to be sexually intimate with someone they love or to whom they feel emotionally attached. Narrowing gender gap. Girls are less likely to save themselves for marriage. Boys are more likely to want an affectionate relationship. Adolescent sexting. This is the sending of sexually suggestive photos or text messages via the internet, cell phones, or other electronic devices. This is increasing among adolescents. Some states have sought to define sexting as a criminal offense. Sometimes this involves images or messages sent between an adult and a minor. Sexual intercourse. Premature sex. Penile vaginal intercourse that takes place before marriage. Adolescent coitus. Upward trends have leveled off and somewhat decreased. Age or first coitus has also decreased. Reasons for engaging in adolescent coitus. Acceleration of sexual hormones. Increased desire and arousability. Curiosity and sense of readiness. Affection for partner. Push to adult behavior. Peer and date pressure. Sexual intercourse continued. Early coitus or predispositioning factors related to having sex at an earlier age. If an adolescent comes from a family in poverty or with family conflict, or they have parental lack of education, supervision, or the parents are substance abusers, they have a higher risk of engaging in sexual activity at a younger age. Late coitus, the predispositioning factors include having strong religious beliefs, good school performance, higher socioeconomic status, and a high-quality parent-child relationship and communication. Adolescent online social networking and communication. Teenagers engage in a broad range of online behaviors, including social networking. There are potentially adverse impact on family relations, often results in declined face-to-face communication. Adolescence and multi-person sex. This is an emerging health concern. Homosexuality. Experimental or transitory same-sex sexual contact between peers is common. Some individuals begin to self-identify as lesbian, gay, or bisexual in teen years. Often encounter negative social or societal reactions. Process of reconciling their sexuality with the expectations can be very difficult. Many lesbian and gay adolescents are unable to talk openly with their parents. The effects of AIDS on teenage sexual behavior. Personal fable. Most teens do not think they are at risk. Adolescents believe they are invulnerable. Condoms viewed more as birth control than as protection from STDs. Condoms are considered inconvenient, and some believe they are already adequately protected from an unwanted pregnancy. Adolescent pregnancy. Adolescent birth rates in the U.S. have declined, but they are still at an alarmingly high rate. Negative consequences of teenage pregnancy. They are more likely to have physical complications, higher prenatal and infant mortality rates, especially at high risk for STIs, the impact on finances and education, and lower parenting quality. Adolescent pregnancy, use of contraception. The use of contraceptions is inconsistent or incorrect. They generally have a lack of knowledge, a misconception about contraceptive risks. They have confidentiality concerns. They fear the pelvic exam. They have feelings of embarrassment. They have infrequent intercourse and difficulty communicating with their partner. Strategies to reduce teen pregnancy. Free confidential contraceptive services. Compulsory national sex education curriculum. Focus on shared responsibility for birth control. Readily available condoms. Increased adolescent parent communication about sex. Sex education. Answering children's questions about sex. Start early and have an ongoing discussion. Share true feelings. Ask open-ended questions. Initiating conversation when children do not ask questions. Children may consider some aspects until they experience them, such as menstruation. School-based sex education. There are different types. Comprehensive sex education treats abstinence as an option, provides a broad base of information. Abstinence-only sex education programs do not delay first intercourse or affect attitudes about sex. Sex education programs do not increase sexual experimentation nor restrain it. They do decrease high-risk behavior. Summary. Traditional views of infancy and childhood as a time when sexuality remains unexpressed, not supported by research findings. Infants of both sexes are born with the capacity for sexual pleasure and response. People show considerable variation in their sexual development during childhood. Diverse influences are involved. Certain common features in developmental sequences tend to emerge.